A question we had recently was from a provider that said, I have a patient in another state that would like to see me and they want to pay cash pay. Number one, you have to be licensed in the state where that patient physically is. So if the patient wants to cross the state line and come and see you in your office in the state in where you are licensed in, that's fine. But it cannot at any time telehealth into a visit with them if they're living in a state or if they're physically located in a state that you are not licensed in. Doesn't matter if they've established care with you in your office or not. If they've crossed that border and are now in a state that you are not licensed in, you can't see them via telehealth. They can keep crossing that state line and coming to your office and being seen there because you are licensed in that state and that where you have your office. They can come over there and see you, but you're not going to be able to see them if they're at home in their other state where you are not licensed. Hopefully that makes sense. The other thing is if they've gone back home, like for college students, for example. So college students, your practice is in the college student town. And now the college student has now moved back home. They're no longer going to college, and maybe they've moved back home into another state back with parents. You can't continue to see them unless you are licensed in the state in which they are physically located. Again, if they want to come to your office to be seen, that's fine. But if they're living across the nation in a different state altogether now, you can't continue to see them. They're going to have to seek care from another provider. You have to be licensed in the state and where your patient is physically at when you see them.